Hello, everybody. Welcome to the TeamSTEPPS for Office-Based Care online webinar on planning and assessing a TeamSTEPPS program. I'm your host, Chris Hund, Director of the National Implementation of TeamSTEPPS Programs, and thank you very much for joining us today. This webinar is part of a library to support all of your work on TeamSTEPPS for Office-Based Care online. This webinar, along with the others, are part of the program, and they will be useful for you in getting your Master Trainer designation at the end of the TeamSTEPPS for Office-Based Care online work that you're doing. Thanks to the Agency for Healthcare Research and Quality, which is a part of the Department of Health and Human Services, for funding the TeamSTEPPS for Office-Based Care online work, as well as all of the other TeamSTEPPS work. It's very appreciated moving the ball forward in the patient safety and quality improvement field through teamwork and communication. Okay, we're going to jump right in today. I want to introduce today's presenters. Today's presenters are both from the University of Iowa Hospital System. We have Michelle Turner, who's nurse manager at the University of Iowa, Iowa River Landing, and Kip Pedersen, who is the manager of frontline operations at the same organization. So we're going to hear from them today, and I'm going to periodically jump in and out with questions, and we hope that you enjoy today's webinar. All right, Kip and Michelle?
Awesome. Thank you guys so much for the opportunity to discuss our experience that we've had in developing an office-based program for TeamSTEPPS at our facility. We're really excited. About a year ago, we attended the master training in Minneapolis, and we've had the unique challenge of starting this program at Iowa River Landing. So I first want to start by describing our institution and the unique setting that we have at Iowa River Landing. Iowa River Landing is an extension of the University of Iowa Hospitals and Clinics. On the left-hand side of your screen is a picture of the University of Iowa Hospitals and Clinics. On the right-hand side is Iowa River Landing. So Iowa River Landing was built to decompress the ambulatory population at the main hospital. The main campus, University of Iowa, is one of the only comprehensive academic medical centers and regional referral centers. It's a level 1 trauma center and tertiary care center in Iowa. And like I said, the Iowa River Landing was initially built to decompress the main campus. It was opened as an off-site ambulatory care center for outpatient visits. We have over 20 specialties at Iowa River Landing, ranging from pediatric specialties, women's health, dermatology, cardiology. We have a procedural sedation suite and many other specialties. We also provide primary care within our family medicine clinic. We have a pediatric clinic and our internal medicine clinic. So within that building, we have, like I said, multiple different clinics. Our clinic sizes range in size of staffing from 1 to 2 registered nurses in a clinic, 2 to 3 medical assistants, to areas where we have 7, 8 nurses and 20 medical assistants. So I think this is important to remember as we discuss our approach to how we initiated TeamSTEPPS throughout the facility, and our hope is that those that are listening are able to identify with one of our clinics because of the various sizes, specialties, the fact that we have a procedure area, and that you'll be able to identify with one of those areas. So thank you so much for having us.
Thanks, Michelle. So as we look at today's objectives, we want to really emphasize the 3 main things that we did at IRL. So our goal at IRL over the last year is to implement TeamSTEPPS across our entire building. So today we're going to specifically talk about how to identify a champion, organizing your change team, as well as selecting the area of implementation and assessing the environment.
We really wanted to make sure that we put this slide in our presentation because this is a slide that we show at every presentation. We feel that it really encompasses the mission that we're trying to accomplish by outlining the definition of TeamSTEPPS and the outcomes that we're trying to achieve. We feel that it's important that all of our team members know that what the outcomes are, which as on the side, knowledge. We want to make sure that our team feels that they're on the same page, that they have the ability to have their voice be heard, the attitude to be team-oriented, and of course, our #1 initiative to improve safety and the patient experience every day. So this is a slide that is very important to us.
So the first objective today that we're going to talk in detail about is how to identify a champion on your team. When TeamSTEPPS was introduced to Michelle and I personally didn't have any experience with TeamSTEPPS, so going up to Minneapolis was kind of an eye-opening experience for me. And so being the project lead that Michelle and I are, we were the champions of IRL, but we were identified by our medical director. And we believe that we were selected to be the champions for TeamSTEPPS because of our experiences both on the frontline operations and Michelle's experience on the clinical influence. And so together we thought we made a well-rounded team, and we had representation from the entire patient experience when you come and visit us at IRL. We're also viewed as leaders among staff and administration. We believe we have high energy and a consistent approach to teamwork, and we also have the freedom and ability to fluctuate our schedules to accommodate implementation. This is an important piece depending on who you choose as your champion, because they are going to need some time, what we call off stage, to really focus on the project, get their project plan in place, and really focus on the details. And lastly was a strong working relationship with our providers, and we're going to talk a lot more in detail about that later on in this presentation.
So yeah, bouncing off of what Kip said, a champion must really possess skills that really set them to be an effective change maker. We feel that a champion needs to be highly respected by all staff. It needs to be people that can motivate others to influence change. Really needs to be a person that has a positive approach to teamwork at all times, and can have those conversations of positive, constructive feedback with staff, and strong communication and organizational skills. Again, backed by having the support and the time and ability to be able to do the work and put in the time that it takes to implement TeamSTEPPS.
Hey, Michelle, this is Chris. I have a quick question.
Yeah.
Do you think that a champion needs to be somebody in a formal leadership position like you and Kip are, or somebody at an executive level, or can it be somebody that's maybe considered more of a situational leader?
Yeah, I don't think that they necessarily have to be an executive or someone in a leadership position, but again, I think they must have the support that's available, the desired skill set that we discussed, the time and ability, and the buy-in from the staff members. I think a situational leader has to possess the skills that when a situation on the unit arises, they are able to pull from the TeamSTEPPS toolkit and utilize that in a positive and effective way. So not necessarily, but again, I think they need to have that support and availability.
Thanks.
And if I could add just a little bit to that, to the situational leader, our ultimate goal with implementing TeamSTEPPS at IRL is to really give everyone, titles aside, the skill set and the tools from TeamSTEPPS so that everybody can really be a situational leader and feel comfortable addressing conflicts, tough conversations, but most importantly, our patient safety.
I think that seems really important to make everybody on the team feel like they're the potential to be a leader.
Absolutely.
So the next objective that we're going to go through today is organizing your change. We refer to our change team at IRL as our IRL TeamSTEPPS core team, but they're essentially the same thing. But before we implemented our core team, we thought that it was extremely important to sit down with our management team before doing anything. And so Michelle and I sat down with our IRL management team and went over our project plan, the importance of establishing a strong foundation of teamwork and culture. And the reason we thought this was so important because we knew that as we roll out TeamSTEPPS, our end users, our staff, will be going to their direct managers, and we wanted to make sure that our management team was provided the same tools that Michelle and I were at our master's training course. So some of the tools that we trained our management staff on was situational awareness, SBAR, CUS, and DESK. And the reason that we chose these fundamental tools is because we meet once a week as a management team. And so we had a good sense of the different scenarios and situations that come about in their day-to-day life. And we thought these tools were very applicable to what they do on a day-to-day basis. And so kind of setting a strong foundation at a management level before we even went to implement with our core team.
Kip, that seems like a great idea. Was there any pushback when those tools were introduced, or did people really embrace them right away?
I felt like everybody embraced it a lot, and people were extremely excited about it because they knew that it was going to have an impact house-wide. And we have such a great management team here that everybody is already kind of team-oriented, and for us to go out and say, hey, we're going to take these wonderful tools from TeamSTEPPS and give them to your staff so that your staff now can start to resolve some of the issues within their own areas without even coming directly to you at first.
Great, thanks.
So to kind of go off of what Kip said, go ahead, is the characteristics, like Kip talked about, we know this is a large building, but there's a lot of small clinics, and we do a lot of rounding. And so as a nursing, the nursing side, I round on frontline, Kip rounds on nursing. You know, we make sure that we are visible to all of our team. So we do kind of know the characteristics of the people in our building. And so we were very strategic when we and sat down to really decide who we wanted on our core team, because we knew that the core team or change team really is going to be a vital driving asset to the sustainability of TeamSTEPPS. We considered this team kind of our super users, the people that were going to be able to go out there into the clinics and pull from the toolkit and utilize what we discussed. And so we looked at characteristics of what is it that we want from our core team. And those characteristics were very similar to what we looked for, what we feel like is important for champions. So that's people that are passionate and outgoing, people that are viewed as leaders in their respected areas, they're respected by their peers, and have strong communication skills. And again, I don't feel like that has to be like someone that's in a lead status or a charge status, but someone that really has a positive, respected role in their area or their specific clinic. So we did meet with each of the different disciplines, and when we chose champions from each of those areas, we looked at areas that each discipline that a patient touches as they come into our clinic, into Iowa River Landing. So, you know, we know that a patient first interacts with frontline, they interact with the clinical team, providers, we don't have on this list, but providers, we had several providers on our core team, pharmacy, lab, radiology, and housekeeping. So really the entire patient experience, and picked those people that possessed the characteristics that we were looking for in our core team. And then when we had chosen our core team, we really celebrated the invitation. So we sent a fairly formal invitation to each of the core members, and then Kip and I divided the team and individually approached them so that we could explain to them what TeamSTEPPS was, what our objectives and expectations are of them as being kind of the superstars of our core team, and really celebrated that so that it was a privilege to be on the core team. And we feel like that really generated excitement about TeamSTEPPS.
Yeah, I bet you that really got people going. I love the idea of having the invitation, the formal invitation to people, and it's great that you included people from across all the disciplines in the facility too. A lot of times people don't think to do that, and it's really important.
You know, it was interesting. Some of our biggest successes were some people that we wouldn't have thought of that really spoke up. You know, people from housekeeping that had great ideas and positive change within the facility. And we were. I think it's very important to include all disciplines.
That's great.
So the next piece is getting the physician buy-in. This is extremely important for the success of TeamSTEPPS, and especially doing it as a building as large as we had. So what we did, we went back to the same core characteristics that Michelle just talked about, and we sat down and we identified who is it in our building from a physician standpoint that possesses those core characteristics that they could come in and join our team. Once we felt like we had a pretty strong list of physicians, Michelle and I sat down with our medical director and proposed that these were the physicians that we would like to propose for our core team. And then once we had buy-in from our medical director, we actually sat down in person with the physicians that we identified. And what we went over was, what is TeamSTEPPS? What's our goal? What's our project plan look like? And what's their role on our team? Another thing that we did was we asked them for feedback. So it was a very open discussion. What are some things that you experience in your clinic today that you'd like to see improved? And lots of times it comes back to communication. And so we were able to sell TeamSTEPPS right from that and say, TeamSTEPPS provides us a great toolkit of different ways to communicate within our clinic from all different perspectives. And so that was a good sell for our point. And we had a quick win, which is very important when you're trying to roll TeamSTEPPS out, is one of the physicians that we identified, and Michelle and I didn't know this, but they had previously participated in TeamSTEPPS at another organization. And so they started telling us stories of success of TeamSTEPPS when they implemented at their other organization. And so we had them present to our core team, which was a very passionate and emotional experience, which, as we all know, can gain the interest of everybody on our core team. And so it was like an immediate impact, and people bought in right away, which was a very quick win for us and very powerful. And we still have this provider come to each group as we're continuing to roll TeamSTEPPS out and tell those stories to get the early buy-in from staff.
That's great, Kip. It's so important to have physicians on the team, of course, and it seems like because of your efforts and because of this provider's efforts, you really got people to take ownership of this, and they didn't just say it was a good thing to do and just kind of walk away. They made it something that was a part of who they were. So that seems like laying this foundation with these physicians is really important for that.
Yeah, and I can't emphasize enough how important it is to have that conversation face-to-face. It's more powerful than getting it through an email or over the phone. When you can sit down and have a great open conversation with the physician, the buy-in is going to be even more powerful for you.
That's great.
So we talked a little bit before about generating an excitement. We know that down the line, some of our challenges will be like, what will be our sustainability approach, and how are we going to get our building to know that this is not the flavor of the month or the program of the week or whatever, because we are very dedicated and excited about TeamSTEPPS. We're very passionate about rolling this program out, and we want our building to know that. And so we have done a few things just to make sure that, and to kind of go back with 20 different areas, we want to make sure that we do it right with each area. So it is a slow rollout when it's only the two of us. So with the other teams that haven't had TeamSTEPPS, I mean, we hear all the time, when is TeamSTEPPS coming to us? Or we just did annual evaluations, and when issues in clinics got brought up, the team members or staff actually brought up, when is TeamSTEPPS going to come to us? I think TeamSTEPPS would be really helpful to our team. And so we know that kind of the constant conversation about it and and visibility of TeamSTEPPS is important. And so we have some examples. On the left-hand side is a picture of the inside of our elevators. We have screens inside of our elevators, and so we always have a rolling TeamSTEPPS slide up there that has what we're doing, what teams we've rolled TeamSTEPPS out, who we're coming to next, and then positive quotes, things that are happening. The middle section is our potty pushers. So those are in all of our staff bathrooms. There's the fourplex where we have a TeamSTEPPS newsletter where we discuss, things in the building that are occurring, new providers that are coming, new services that are coming, new people that have started, just a newsletter about the building. And then we always have a blip about TeamSTEPPS, maybe highlight a tool for the week, and we always put positive quotes up there. And then the bottom part of that are patient feedback comments, because we feel that's important to employee morale as well. So, and then on the right-hand side is a picture of members of our procedure team, and that was the first actual team that we rolled TeamSTEPPS out to. They were our quick win team because they were already a very cohesive team, and we knew that when we started, we knew that we could get a quick win, and they would be a good team to roll this out to. So we asked them to speak at, as soon as we started TeamSTEPPS with them, we asked them if they would speak at one of our all-building town halls, and so that's where providers, housekeeping, lab, all members are at that town hall. And we asked them if they would just explain to the building what TeamSTEPPS meant to them and what they've learned from TeamSTEPPS. And we didn't script it with them. We just let them go up there and talk. And it was very, very powerful coming from we can talk about TeamSTEPPS and be excited about it, but when it's their peers that are up there and saying, hey, we feel like this is making a real difference in our procedure team, and we feel like we're able to speak up, and it's a safer environment, and we're all on the same page, and we're doing huddles, and we're doing debriefings, that's powerful, and that makes, really generates excitement within the building.
The next piece that's extremely important is trying to find time to meet with your team. So this is something that we've learned along the way, that one of the most important things is to find a time that's going to work with everybody and schedule the meetings far in advance. And so what we did with our core team was we met the first Tuesday of every month, and we scheduled the first 5 months out. So we met at 7:30 a.m. to 9 a.m. And the advantages of doing this is so that your managers can go ahead and flex their staff to cover the staff that are going to attend the core TeamSTEPPS training, so that the patient experience here at IRL is never affected by any kind of training that's taking place. Another advantage, too, of doing this is so that everybody can plan their own personal life around it, too. We found that our core team members loved TeamSTEPPS. They really bought in right away, and so they also wanted to plan vacation time or doctor appointment times around it as well, so that they couldn't miss a TeamSTEPPS meeting. And then lastly, we talked about it a little bit earlier about making sure that TeamSTEPPS isn't a program of the month or a flavor of the month kind of initiative, but this is more of the new way of life. We think very highly of our patient experience here at IRL, but we really strongly feel that TeamSTEPPS is going to take us to that next level, and will now kind of create this culture of teamwork and togetherness, and it's not just a program of the month.
Hi, Kip. This is Chris. Just a couple questions here. First off, how did you find a time that really worked for everyone? I think that it might be easier in a larger organization like yours where you can do that flex time, but what would you do if it was a small practice where it's always all hands on deck? There might be one provider or only a few nurses.
Yeah, and what's nice about is that we do have those kind of examples. We do have clinics here at IRL that are smaller, like Michelle said, maybe a nurse and a handful of medical assistants. And so it's a much smaller team as opposed to a large core team where we're talking about 25 people. And so some of the things that we try and do in those situations is, can we do it over the lunch hour? Can we identify proactively, look at the schedules and see, do we have a physician that may be on vacation or a clinic day where the volume is down, where we can take advantage of that time and pull the team off the floor and go through TeamSTEPPS? Those are some of the approaches that we've taken that have been very successful.
And to kind of add that, it definitely takes the commitment from your upper administration. I mean, it's a financial commitment, you know, paid lunches, and we've done breakfast where we have them come in early. So we certainly understand, and we struggling with trying to find times within, you know, Kip and I also have, you know, our other full-time job, and so finding time to be able to do this is a challenge, but it truly does take the commitment from your leadership to be on board to committing and being okay with maybe blocking a couple appointment times and being okay with paying lunches and ordering food for people. So I think that's very important as well.
And that's where what you said about this being something that is not the flavor of the month, something that's really a part of the culture, that's where that's so important, is to convince people in that. And how do you go about convincing the non-believers, people who say, yeah, other people have told me that something's not the flavor of the month and that goes away. So what are the real ways that you've been able to get to those non-believers?
So yeah, no, that's a great question. Some of the things, I would go back to the slide where Michelle talked about generating an excitement. By generating excitement, it creates a very contagious environment, and if you can get people to really buy in, find your people that are going to buy into change, going to be your sellers or your people that are going to go out and promote it, it creates a very contagious environment where either I'm going to jump on board with my coworkers and peers and really buy into this new concept, or I'm probably going to stand out a little bit and go against the grain. So those are some things that we really pride ourselves on, and it goes back to kind of setting that strong teamwork foundation, finding the right people to kind of champion with, and then generating that excitement.
Yeah, that makes sense. Thanks. That's a good point.
Something we did with our nurses is, like I said, we just had annual evaluations, and we put kind of 2017 initiatives, and we put, you know, TeamSTEPPS in this and put some tools and laminated it for everybody so that they were very aware this is not going away. This is something that we are passionate about, and these tools are important for patient safety, for staff morale, and so I think when they know that we are very serious and passionate about it, and then you have that generated excitement and administrative support on top of that, I think it's a recipe for success.
And maybe one more thing too is what Michelle and I did, and we made it a point early on, was the first couple emails you get where somebody writes them in S-bar is like, celebrate it. Share it at your next TeamSTEPPS meeting, like, hey, look at this wonderful email that I got in an S-bar format. We had an example here where somebody stopped the line and a physician recognized a medical assistant for stopping the line. That was celebrated throughout our entire building, and so that also comes back to generating excitement, because people love to hear stories like that. They love to see coworkers and peers being recognized for great things they're doing.
Oh, that seems like a fantastic idea to really celebrate that good behavior. It really reinforces it, so that's great.
So we're going to talk about the next objective, implementation and assessing the environment. So where to start? This was certainly Kip and I's driving back our 5-hour drive from Minneapolis with our big TeamSTEPPS notebooks going, oh, where do we start? What do we do? Where's the agenda and how does this work? And so I think the one thing that we took away from TeamSTEPPS master's training was the importance of finding your high-functioning clinic and choosing that clinic. So we did have a already high-functioning clinic that possessed a lot of the team cohesiveness and positive patient experiences and good outcomes already. We knew that they would be a team that would be engaged. It would be a quick win. So that way we could generate the excitement about the new techniques. We knew that we would be able to utilize, they would be able to utilize huddles, the debriefing, and utilize the tools to improve their teamwork. So that was kind of our first decision on kind of where to start to get that quick win and then to create early momentum. So that was our procedure team, and then also our core team, because we've, like I said, we feel like having those quick wins and having success breeds success.
So, Michelle, I want you to put yourself in the shoes. Let's say you worked at a really small primary care office, and there might only be a few of you in that office working there, and so it maybe isn't the perfect environment. It may not seem like a very high-functioning clinic like the one you were able to choose at IRL. So what would you do in that situation? Would you go forward anyways, or would you wait and try to see if things would improve?
No, I mean, I think you definitely, you know, TeamSTEPPS doesn't have to be initiated by only a high-functioning clinic. You know, we've had clinics that we've rolled it out where it was a smaller clinic, or clinics that we knew that they had some culture issues. And so I think you just have to adjust your approach and, you know, look at what areas you really want to focus on. We're going to talk about a few techniques that we did and the way that we kind of adjusted our approach, but I think it's being able to tailor the program so it's not a cookie cutter program, and being able to tailor it to the environment and the culture that you have, that you're working with.
That makes sense. Thanks.
So I'm going to talk a little bit about how to assess the environment. So as we identify clinics where we want to roll out TeamSTEPPS, one of the first things that Michelle and I do as part of the assessment is we really devote time and go and spend in the clinic, where we'll sit with medical assistants, nurses, frontline staff. We'll even go into the exam room with the physicians, and just to see how the whole staff cohesiveness is, see how their communication, how that communication piece looks. Clinic efficiency is really important to us. So we devote a lot of time of just going in and almost being like a fly on the wall, you know, getting a good feel for how that clinic operates on a day-to-day basis. Another tactic that we took that we really, really enjoy is we have the team that we're about to roll out TeamSTEPPS with. We have them define what the word culture means to them. And so it's very difficult at first for them to kind of break down that and to identify what's important to them when it comes to culture. And then once they have their definition, we have them rate their culture on a 1 to 5 scale. So we can show them right up front, like, this is how your peers, this is how your team is rating your current culture, so that you kind of have a pre-measured TeamSTEPPS, and then once we wrap it up, we have them reevaluate culture and have them rank it. The next tool that we use that's very powerful, that Michelle's going to talk to in great depth, is called silent brainstorming. So I'll hand it over to Michelle.
So this is something where we talked about the difference in, you know, a smaller clinic or a clinic that's maybe not, doesn't already have that team cohesiveness. This is a tool that we found to be very effective in kind of the very early stages of rolling out TeamSTEPPS. It's something that we do very early on. So silent brainstorming is we ask them a series of questions. We have a few examples of the questions, but each question has a different color Post-it note. So, so for example, the color blue may be the question, what gets in your way when providing excellent patient care? And then we have them anonymously write down what is it that gets in their way? What do patients and families see, hear, and feel when they come into the clinic? Another question, if you could change one thing that would improve the care for your patients, what would that be? And we have about 6 questions that we ask them and have them put them on different colored paper. And like I said, it's anonymous. They write it all out. We collect them all at the end and then shuffle them up. And then we divide the answers up, to the various tables. So we have people in tables. And we feel that's really powerful when they actually touch their issues and they put them into categories. And so this shows us, gives us a really good idea of what is it that we need to focus on. Is it culture? Is it workflow? Do we need to, focus on communication? And so this has been something that we have been able to tailor the program based on the responses from this silent brainstorming, and then also, like Kip said, where we have them rate the culture, because it's very surprising. And then we show them what their answers are, and sometimes there's a range of answers. Sometimes people are surprised when they can put things down anonymously. So this is a powerful tool that we have found that works.
Michelle and I also use this tool to help kind of customize the TeamSTEPPS tools and how we're going to roll out and what we're going to roll out with that team. And we've also found that this tool is very effective so that maybe you have somebody on your team that's very outspoken and they sometimes could dominate a team, a presentation. Or you may have somebody that's really quiet, doesn't feel comfortable speaking in front of a large group. So the silent brainstorming kind of controls that environment a little bit and gives everybody the opportunity to voice their concerns and also voice things that they think are going really well in the plan. The next piece that's really important when you're implementing TeamSTEPPS is making sure that you're reviewing the data. So there's a couple of different techniques that we've taken about reviewing data, but I would say the first thing that's important is make sure that you use the tools that are readily available to you already. Don't set yourself up where you're having to run reports manually and spending a lot of time running data behind the scenes. Use what's available to you, and that's an early win for us. We learned along the way early on we were doing a lot of man-made reports, and it was just taking up way too much time on our end. And so what we ended up doing is there's 2 great TeamSTEPPS tools out there for you, both online and in your toolkit. And what we've done is we've kind of combined these 2 TeamSTEPPS tools into an online survey. There's lots of online surveys that you could look into getting. We use what we call Qualtrics. Some people use SurveyMonkey, but we combined these 2 surveys into one survey. And our plan is we send this survey out via online. Staff can fill it out again on their own time and then submit before the implementation of TeamSTEPPS. They get the same survey once TeamSTEPPS is fully implemented, and so you can see the progress that you've made during your implementation. Another thing that we do is we look at patient satisfaction. So for us, we use Press Gini. By no means is Press Gini our end goal for implementing TeamSTEPPS. We simply use Press Gini to get a feel for how the patient is perceiving our care that they receive when they come to IRL. So we look at things like how do they view us as staff working together, likelihood to recommend, does our care provider include us in decisions? Those are things that we like to look at so that we can proactively identify trends or maybe some issues that we need to look into deeper as we're doing our clinical observations. We also break down our patient comments and make sure that, again, looking for trends, looking for things that we can address and use TeamSTEPPS to help fix. And then lastly is clinical reporting. So we use our electronic medical record system to look at clinic efficiency, staff efficiency. We really like to surround ourselves with some supporting evidence for the measurables and the success of TeamSTEPPS.
And then definitely we've learned lessons along the way. We kind of hit the ground running with TeamSTEPPS. We're very excited after the master's training and really got going. And so some lessons that we've learned is the importance of engaging the physicians, and we've talked about it through this webinar, but the core team, we had providers available on the team, and that was a great group. It was so powerful. With the next couple of groups, we didn't make it mandatory. We invited providers, but you know, we didn't stress the importance, I think, of having, how important it is to have physician engagement. And we learned from those groups, one particular group saying, how come our providers aren't here? And that was really important to them. And so we got together with our medical director and talked about, you know, how can we involve providers? And so, you know, we don't always, they don't always listen, you know, we don't have as much control, and they have a lot more, you know, they don't have as much availability. And so the group that we just recently did, our medical director required that it's a mandatory thing that they go to. And he personally approached each one of them, stating how important it is that they are there. We did it over a paid lunch, and that was an incredibly successful group. So I think one lesson for sure is the importance of engaging physicians. We have learned how to adjust our approach for each department. Small, we have big groups. One of the issues we found is that with the bigger clinics that we have that run, you know, hundreds of patients through, it's hard for us to have them all in one room at one time. And so we had to divide that team to be able to avoid any negative patient experience, not having enough staffing. And that isn't ideal. It's more ideal to have the team all there at one time, but with some of our busier clinics, we really didn't have any options. And so that was the most successful way that we found to be able to roll it out to the bigger clinics. We've learned that it is important that you schedule all the meetings all at once and commit, because if you say, all right, we're going to do one in June, and then something always comes up and something else comes up, and so putting them on people's calendars and committing to the actual to actually doing it is so important. And then we can't stress enough the importance of generating continual excitement, and that's what we feel will be something that improves our sustainability and continues the positive buzz throughout the building.
And so in this kind of wrapping up our presentation today, this is the motto that we came up with as a core team. So our motto at IRL for TeamSTEPPS is one team, one goal equals exceptional patient care.
Kip and Michelle, thank you so very much. I think that when you're talking about generating excitement, I think that you probably really did that, because you got me excited about all the work you're doing, and it seems really applicable across many different settings. And that's what's great about where you're coming from, is that you have this ability to take lessons learned from everything from a very small office with only one provider and a few nurses to an office of 25 or more people. So that's really good stuff to be able to get to learn from all those different locations. But thank you both very, very much for doing this today. I appreciate it very much. You definitely are two strong leaders, and that's what everybody seems to need when they're implementing TeamSTEPPS.
Well, thank you for including us on this. We're excited to be a part of your guys' team as well.
Thanks, Kip. Well, everybody, you're welcome. Thanks, Michelle. Well, everybody that's listening, thank you. That concludes this webinar. We're really excited to be with you on this journey. Know that you're not alone. There are clinics and small offices and hospitals and long-term care facilities really around the world that are engaged in this work. And so we hope that you keep engaging us with dialogue, that you keep enjoying your time with the TeamSTEPPS for Office-Based Care online course, and that you reach out if you have any questions. Thank you very much, and we'll see you next time.